Another contingent of defence reinforcements has arrived in Melbourne as our battle to beat COVID-19 enters a precarious phase. 238 fresh cases have surfaced, the first signs of stability. But a woman in her 90s has become the 27th Victorian to lose their life. Frustrated police have blasted the bizarre excuses that rule breakers are using to flout the stay-at-home laws. And the AFL is sending all Victorian teams to Queensland to ride out the rest of the season. Andrew Lund begins our coverage.
It looked and sounded like a disaster relief operation, as dozens of Defence Force personnel wearing masks and gloves filed across the tarmac at Tullamarine after touching down on two RAAF transport planes late this afternoon to bolster Victoria's fight against COVID-19.
The arrival of additional support will be a feature of many days to come.
Overnight, a woman in her 90s became the 27th Victorian to die of coronavirus, as the state recorded another 238 new cases. 14 others have been reclassified, with a net increase of 224, taking the total to 4,448. 1,931 cases are currently active.
We are seeing just a little bit of stabilisation in numbers over the last few days, but it's still a significant number.
105 Victorians are now in hospital, 27 are in intensive care, 22 of them on ventilators.
Where we are is in a very serious and deadly position. These hospitalisation numbers are a great concern to us. 1 in 100 or more die. So when we have 238 cases every day, we're looking at 2 to 3 deaths in a week or more's time.
Since the return of Stage 3 restrictions across metropolitan Melbourne last week, police have issued 546 fines, including to a group of 10 caught drinking around a heater in Bentley overnight, a man who insisted on eating inside a Dandenong KFC restaurant, and 2 men found in a parked car in Seville playing Pokemon.
The reasons for leaving your premises are well known. I can say they don't include playing Pokemon.
For now, the government is pinning its hopes of controlling the virus on Melburnians obeying the rules. But it's warned that if the current directives aren't followed, then tougher restrictions could be required.
The likelihood of further restrictions and the length of the current restrictions is in the hands of every single Victorian.
But a Laverton North abattoir owner says health authorities failed to provide clear guidance after one of its workers tested positive.
We have had to follow up DHS ourselves. There has been almost zero follow-up through the whole process.
There were no further cases. I think the risk assessment was made. It was probably appropriate.
The number of cases linked to the public housing towers in North Melbourne and Flemington has risen to 247, with 36 cases connected to the Carlton Towers. The cluster at Altaqua College now totals 150 cases, while the Somerville Retail Services meat packing cluster has climbed to 33. 21 cases have been linked to the JBS abattoir in Brooklyn. 9 have been identified at Embracia Aged Care in Moonee Valley, and 2 cases have been confirmed at St Basil's Homes for the Aged in Fawkner.
This wave is trickier, and so it won't be as easy to drive numbers down with the community transmission that's out there.
Now, Andrew, the Health Department has revealed how many cases are linked to the Black Lives Matter protest.
Yes, Pete, you'll recall it was quite contentious, but more than a month after the protest here outside State Parliament, the department says it's aware of just 6 cases that have been detected in demonstrators, and it says there's currently no evidence to suggest that any of them acquired the virus at the march. In a statement, it says that none of these cases are known to reside at a major public housing complex, and that currently no known nor suspected episodes of transmission occurred at the protest itself. Of course, the finger of blame for this current outbreak is largely being pointed at the state's hotel quarantine operation. An inquiry into that is due to start on Monday. Pete?
OK, thanks, Andrew. More than 10,000 nurses, doctors and other medical staff have volunteered to join the coronavirus fight. As Mark Santomartino explains, they'll replace infected or battle-weary colleagues.
Backing up those manning EDs and drive-through testing is a volunteer army 14,000 strong.
It's not as much at the moment about lots of people getting infected. It's really about a lot of people being quarantined.
342 healthcare workers have been infected with COVID-19 this year. Their replacements still waiting to be called in are 40% nurses, doctors and paramedics. 31% of the volunteers are from allied health or are a patient care assistant, with the remainder made up of medical, pharmacy and dental students.
We wouldn't be putting people who aren't trained into a risky situation. We're looking at other roles where they might be able to help with support or writing information down.
At least 114 healthcare workers are currently infected with COVID-19. Cases have spread to several aged care homes as well as to staff at the Royal Melbourne, the Alfred Hospital and the Brunswick and Warrigal private hospitals. The Northern is the only hospital in Melbourne that's been caught short so far, forced to redirect patients to other hospitals after infected staff and close colleagues needed to be quarantined.
My understanding is that the health staff who are furloughed makes it tricky, but it's all being managed within the existing workforce.
5 million masks from the national stockpile are on their way to Victoria.
I think it's time that respirator masks are made available to frontline staff, particularly those in emergency departments and on wards where COVID-19 is managed.
We're under significant strain with the system. We're finding that tests are not coming to us and notifying us in a timely manner whether they're positive or not.
Mark Santomartino, 9 News.
Residents in Melbourne's southeast have been warned they're not immune to the virus. Reid Butler's at a police checkpoint in Cardinia Shire. Reid, infections are on the rise.
Correct, Pete. So far, the focus of this second wave has very much been on Melbourne's northern suburbs, but tonight, concerns for residents in the southeast. Of the new cases recorded in the past 24 hours, 8 have been detected in the local government areas of Cardinia and Casey, including in a Woolworths employee who was working at a Woolies in Officer at the Arena Shopping Centre. Now, tonight here at this police checkpoint in Longwarry, officers and members of the Defence Force are pulling over vehicles to check their details. There is a very long queue of traffic here tonight, Pete. There has been some talk of potentially introducing a permit system for those who need to cross this border regularly, but I've spoken to Victoria Police today and they've been unable to provide an update on when or if that will happen, despite the fact there is a lot of motorists really desperate for it. Pete?
OK, Reid, thank you.